Good morning, everyone. I hope you're all doing well today. I'd like to thank you for joining us and for everyone expressing interest in our meeting today. I'd like to welcome you to our second meeting for our Research and Evaluation Network for 2022. The theme of today's webinar is Demonstrating Impact Through Data, with a focus on community services and university partnerships. Just going through the agenda today, we'll give a quick overview of QCOS Research and Evaluation Network. For those of you who have may not had the opportunity to join us at our last network meeting, we'll also revisit the purpose of the network and our plans for the network in 2022. And we're going to have about a 15-minute discussion around data impact and outcome measurement. And we're very excited to welcome our two guest speakers for our event today. Nathan Middlebrook from St Vincent de Paul Society, Queensland, and Christine Ablazer from the University of Queensland School of Social Science. So Nathan and Tin are going to share some of the lessons they have learned through their data partnership over the last few years. A couple of housekeeping things to note. If you're not already, can you please put yourself on mute? If you have a question, please use the chat function. There will be an opportunity for some discussion and Q&A after Nathan and Tim's presentation. So please use the Q&A or the chat box. And also to note that the session is being recorded. So if you don't want your face shown in the recording, please feel free to turn your camera off. I would like to acknowledge the traditional owners and custodians of this land, the oldest continuing cultures in human history. I acknowledge the Yagara and Turrbal people of the lands on which I work and live here in Meanjin, Brisbane. I'd also like to acknowledge the Yugambeh people of the Gold Coast where I was raised. I'd like to acknowledge all First Nations colleagues joining us online today. I honour your customs, cultures, connections with country, kin and community, and elders past and present. For those online, please feel free to join us in acknowledging country where you are today through the chat function as well. I'd also like to acknowledge today, the 26th of May, as National Sorry Day. Sorry Day is a day of reflection to remember the mistreatment of Aboriginal and Torres Strait Islander people who were forcibly removed from their families and communities, which we now know as the Stolen Generations. This is a significant day to reflect on this historical injustice and the continued effects and intergenerational trauma caused by the forced removal of Aboriginal and Torres Strait Islander people from their families, communities and culture. I acknowledge and pay my respects to the strength and resilience of the Stolen Generations survivors. Again, I would like to thank you all for joining us today. In particular, I'd like to welcome our QCOS members and acknowledge the work that you do in your communities. I'm really enjoying having the opportunity to get to know more of our network members, and thank you to all our wonderful community services staff who continue to educate me on the software and systems that are used within the sector, as well as sharing and highlighting the achievements and challenges that your organisations are facing in outcome measurement and impact evaluation. So I'd like to also do some quick introductions and acknowledge some colleagues online today. Scott Brown, our QCOS Director for Research and Advice. I'd also like to acknowledge all my QCOS colleagues online today. My name is Amy Dellett. I'm the Data and Reporting Analyst for QCOS, and a component of my role is to coordinate these Research and Evaluation Network meetings. To share a bit about me, my background is public health, and I have over 10 years of experience as a data analyst, working in government and non-government sectors, and I also have an 8-year-old daughter. In my career, I've had the opportunity to use my technical and research skills across areas including health, child safety, housing, aged care, disability, education, domestic and family violence, employment, crime, justice, and demography. So I'm really excited to facilitate this discussion today for the network. The intention is to adopt a strengths-based participatory focus that leverages, draws on, and values current knowledge, expertise, and capabilities that exist within the sector. We come here today with a shared purpose, an opportunity for collaboration and sharing knowledge in the areas of research and evaluation, with the aim of more effectively using community sector resources to promote improved outcomes. In terms of membership, these network meetings are open to everyone, as they're about sharing resources and collaboration. However, social services staff in research and evaluation roles are particularly encouraged to attend. So we'll attach the terms of reference to the meeting we'll send out after the webinar for any new members or existing members who wish to review them. And to join, or if you have any questions you'd like us to follow up with, please email our team at QCOS at research@qcos.org.au. So for those who attended our webinar last month or watched the recording of the webinar, you may be aware that this year we're tailoring our research and evaluation network activities to focus on data capacity strengthening and supports. So we've structured our activities, including the topics of these webinars, around 5 domains: data infrastructure, data impact, data access, data capability, and data governance. So the domains were selected and informed by the Swinburne University of Technology Building Data Capacity in the Not-for-Profit Sector interim report released last year, as well as the ongoing work we have conducted with the sector, including our data systems case studies and our data evidence and evaluation needs assessment surveys. So for our April research and evaluation webinar, we were fortunate enough to have Rose Ahern from the Centre for Social Impact at University of New South Wales join us to provide a demonstration of Amplify Online, the social sector's first online impact measurement tool that is consistent and evidence-based and accessible and available for not-for-profit services for free or low cost. We talked about data infrastructure and how systems, information technology, and data infrastructure can support and enhance our teams, programs, projects, and organisations to assist community services in capturing and analysing data and to report on outcomes. We also discussed some of the challenges with data infrastructure in the sector, like interoperability and the cost and resourcing required to establish and maintain these technologies. We also spoke about data systems as opportunities to increase staff efficiency, improve service delivery, and save time and money. So the focus of today's webinar is around data impact. The Building Data Capacity in the Not-for-Profit Sector report defines data impact as the implications for subjects from whom data was collected, the effectiveness of data-related outputs and systems, and the service outcomes of data-driven decision-making that can be measured by qualitative and quantitative metrics. So Social Ventures Australia has a resource called Managing to Outcomes, a guide to developing an outcomes focus. And in this report, they highlight some of the key benefits of outcome measurement for not-for-profit organisations. And although this isn't an exhaustive list, some of the benefits of measuring outcomes include the ability to target areas where we can make the biggest difference to community, informed decisions for service planning and delivery, to articulate outcomes for services to sponsors and funders, to increase transparency and further funding opportunities, to allocate budgets and resources more effectively, to find new ways of addressing problems through innovation and continuous quality improvement. Through measuring outcomes, we can motivate and inspire staff and promote collaboration within and across teams. So for today's discussion, I thought I'd frame our conversation around these few points. So are you measuring outcomes in the work that you do? How do we determine if the services we are providing are making a difference? How do we define what success looks like and for whom? And what are the challenges you face in your role in terms of measuring outcomes? How can we overcome some of these challenges? And what kind of support and resources would you like to receive to assist you in outcome measurement? And finally, how can we communicate our impact and research findings better? Please feel free to add any comments or thoughts around these points to contribute to this discussion in the chat pane. So are we measuring impact or outcomes or both? Often people use these terms really interchangeably, and that's because both of them are important. But to understand the difference, I find this is where a logic model or program logic is really useful. So logic models, taking you back to Evaluation 101, logic models are a visual representation of how a program will achieve its goals, including short, medium, and long-term outcomes. And although there are many variations of a logic model, they all have a lot of common elements, which include inputs, activities, process or outputs, outcomes, and impact measurement. So impacts are the long-term changes you want to see. It's the lasting systemic change which your program or organisation contributes to. Impact is potentially something that is achieved after your program or project is finished, and it's not always possible to attribute impact directly to an individual intervention program or organisation. Impacts can be both positive or negative. They may occur directly or indirectly, and they might be intended or unintended. Impact is often the opposite of the issue that you are trying to address. So in this example, which is outlined in the SVA report, the issue is children from disadvantaged backgrounds in New South Wales are not school ready at 5 years of age. And so therefore the impact of addressing this issue is that children from disadvantaged backgrounds have greater ability to learn, contribute, and achieve. Outcomes, on the other hand, are short, medium, and long-term changes for your target group that then come before impact. So outcomes should be as specific as possible, for they form the basis of what you want to try and measure. Outcomes might start with words like improve, decrease, develop, expand, or increase. Outcomes could look like changes in knowledge, attitudes, values, skills, behaviours, or conditions. Outcomes will ultimately lead to the impact and change you would like to see over time as a result of your activities. So in this example, the activities are that parents of these children will attend a parenting course on how to support and encourage their children, how to understand the needs of their children and be educators. So the short-term outcomes of these activities might be that the parents feel more confident in their parenting skills, and parents report greater involvement in their child's development. The medium-term outcomes are that more children attend early childhood education, more children achieve development goals, and family relationships are strengthened. And the long-term outcomes include more children are school ready, children have a stronger support network, and children are more resilient. So are you measuring outcomes in the work that you do? Of the participants who registered for today's webinar, 81% are measuring outcomes in the work that they do. 4% are not measuring outcomes, and 13% of respondents were saying that this isn't relevant to their work, and 2% were not sure. 54% of people registering for today's webinar rated themselves with a score of 4 or 5 as high or very high in terms of their understanding to measure and report on outcomes. 48% of people registering for today's webinar rated themselves with a score of 4 or 5 as high or very high in terms of their confidence to measure and report on outcomes. And 48% of people registering for today's webinar rated themselves as high or very high in terms of their capability to measure and report on outcomes. So hopefully over time, through working together and supporting each other, through accessing resources and sharing our knowledge with the network, and accessing opportunities and supports available to us, outcome measurement can be less of a scary and overwhelming task and more embedded into everyday work. So we've developed some statements in terms of what a data impact vision for the community services sector might look like. So the community services sector can demonstrate the impact, value, and effectiveness of their programs and projects. Community services staff can communicate their impact and assess whether they are meeting their program or organisational objectives through data. There's strengthened evidence base for use in policy advocacy, program design, monitoring and evaluation, and research plans and evaluations are based on the latest available evidence and best practice. Finally, data and evaluation are embedded into projects, programs, and continuous quality improvement activities. So now we have a data impact vision for the sector, but how do we actually get there? How do we determine if the services we are providing are making a difference? So a big component of outcomes measurement is actually collecting and analysing the right data. The Centre for Social Impact has this resource, the Roadmap for Social Impact, where, as the title implies, they take you step by step through planning, measuring, and communicating social impact. So CSI have included this flow diagram for impact measurement, where after you have identified your expected or potential or desired outcomes, you then select indicators and to measure them, and then analyse whether your inputs, activities, and programs are causing the intended effect. So in May 2021, QCOS conducted a survey to examine the use of data, information, and client management systems across the community services sector. The survey explores organisational capability to measure client outcomes and identifies challenges and barriers being faced in the collection, analysis, and reporting of program data. The survey is still open for those who are interested. We're really interested in collecting this feedback from as many organisations as possible. And part of the results will inform this work of then how we adapt and respond to the data needs and challenges identified in the sector, including measuring impact and outcomes. So if you haven't already filled out the survey, I'd really encourage you to do so. We'll send out the link again after today's webinar with the resources, as well as you can see the link here to the survey on the bottom of the screen. So more than 8 in every 10 organisations surveyed are collecting basic demographic data from their clients, including residential address, gender, age, language spoken at home, and Aboriginal or Torres Strait Islander status. Less commonly, community service organisations are collecting information on education, employment, income, family household characteristics, clients identifying as LGBTIQ+, and internet access. Organisations are also collecting program-specific measures about their clients, with client attendance being the most common measure, captured by 81% of organisations. Intake and exit dates, outcome data, referred by and reason for exiting the program are also commonly recorded. And 1 in 5 organisations are collecting workforce data. So as a sector, we're collecting all of this data, but how do we know what to do with it? So measuring outcomes is challenging and complex. And in my experience, it's a lot of people and organisations don't really know where to start. So these next steps are really about identifying and defining our approach, and how we're going to measure our impact. And this can really be an iterative process. You may need to go back and forth and review and reflect on your approach and change things when you need to. So are we measuring impact at an individual or program level? So the micro level, or organisational community level, or meso level, or societal level, the macro level. This diagram on the left of the slide is called a log frame matrix, and it guides us through the process of reviewing relevant indicators and measures against each of the components of our logic model and the relevant data sources that are available. So eventually we want to get to the point of evaluating our impact. We don't really have time in a 15-minute presentation or 20 or 30-minute presentation to discuss and go through all the different approaches, but I do think it's really worth acknowledging that there are many different approaches to evaluating outcomes and impact, and it's worth spending some time trying to think about what approach may work for you in your own program and organisation and circumstances. It's also that maybe multiple methods may be needed to answer a particular question. So how do we define success, and what does it look like? In what ways has a program or project been successful, and for whom? The Organisation for Economic Cooperation and Development, or the OECD, has these evaluation criteria which prompts us to have a curious mindset and to think about impact at a deeper level, So some of these criteria may or may not be relevant or apply to your program, but it can be really useful as a guide for selecting evaluation questions. So these come under the 5 different domains. So relevance, which prompts us to think about, so what kind of, to what extent did the intended impacts match the needs of the intended participants? And to what extent did the intended impacts match the stated priorities of the stakeholders involved? In terms of effectiveness, did the intervention produce the intended impacts in the short, medium, and long term? For whom, in what ways, and in what circumstances did the intervention work? Did the intended impacts reach all intended participants? And how did the intervention contribute to the intended impacts? What were the particular features of the intervention that made a difference? What variations were there in implementation? What has been the quality of implementation in different sites or locations? And to what extent and in what ways did implementation change over time as the intervention evolved? How did the intervention work in conjunction with other interventions to achieve outcomes? And what helped or hindered the intervention to achieve these impacts? In terms of efficiency, what resources have been used to produce these results? How did this compare to similar interventions? And what strategies have been used to ensure the efficiency of the intervention? For impact, what difference does the intervention make? And what unintended impacts, positive or negative, did the intervention produce? In terms of sustainability, these would be measured in like the after intervention, or like a follow-up study would be required. So, for example, are impacts likely to be sustainable, and how have impacts been sustained? So I've also included a couple of slides here on an evaluation framework which is appropriate when working with Aboriginal and Torres Strait Islander people, families and communities in programs and projects. I often hear questions when watching evaluation and research webinars from people looking for guidance around culturally safe evaluation methodologies. And this framework was developed by Megan Williams, a Wiradjuri woman with a wealth of knowledge and experience and expertise working in evaluation, and a mentor of mine from my early days as a public health student. So the Nabinya framework, it's an Aboriginal and Torres Strait Islander program evaluation framework. And Nabinya means to examine, try and evaluate in the language of the Wiradjuri peoples of the central New South Wales region. So the framework builds on program logic foundations in the ways of working component of the framework. But then it asks us to think beyond this and guides us through a series of prompts around landscape in terms of the settings and context in which we're working, resource prompts, ways of working, and multi-directional two-way knowledge sharing in exchange with Aboriginal and Torres Strait Islander peoples. So in no way can I do this framework justice in a couple of minutes, but I really wanted to highlight and recommend you read through this paper and consider these prompts for anyone working in an evaluation. There's also a webinar recording as well here on YouTube, which I've put the link to, which you can access, in which Megan walks you through the prompts of the framework in a really lovely way, step by step. There's also the First Nations Cultural Safety Framework from the Australian Evaluation Society, which can be, it was recently released. It's another really valuable resource to access. So which brings me to my next question. What kind of support and resources would you like to receive to assist you in outcome measurement? So I think it is really useful to have some kind of guide that you can follow and adapt as you need to. There are hundreds of different guides and frameworks and guidelines and templates and handbooks and models, and I've touched on a few of these today. There's also new tools, portals and systems being developed and made available to the sector, like the indicator engine developed by CSI and the outcomes engine by our community. So if anyone would like to share details about the frameworks or models that they find really useful or helpful, please pop them in the chat function as well. So what are the challenges you face in your role in terms of measuring outcomes? So lastly, I would like to talk about challenges. So here we're looking at some data we included in our webinar last month from the latest Info Exchange Digital Technology in the Not-for-Profit Sector report. So the report is an annual research project which is now in its 6th year. It aims to better understand how not-for-profit organisations across Australia and New Zealand are using technology and identifying where areas of growth and improvement are needed. So 38% of not-for-profit organisations reported that their primary systems help them to understand and measure impact and outcomes of their various services, a 6% decrease from 44% last year. These results indicate that outcome measurement is a challenge for not-for-profit organisations, and data systems can both support or hinder outcome measurement. Commercially available systems and bespoke systems seem to fare better in enabling staff to understand service impact and outcomes at 45% and 47% respectively. And government mandated systems also fared okay, with 42% of organisations agreeing the systems allowed them to measure outcomes. So in our data evidence and evaluation needs assessment survey for the sector, we asked, what are the challenges and barriers your organisation has in collecting and analysing data? Barriers identified included competing priorities and a focus on service delivery, with 63% of organisations saying this was a challenge. 56% of not-for-profit organisations said positions are not funded to undertake data analysis activities. 1 in every 2 organisations said unclear or lack of data standards in the sector made collecting and analysing data a challenge. 45% of organisations noted that they had limited time to collect and analyse data, and 38% said staff skills are limited in data analysis. Poor quality data was also a challenge for 28% of services. And there are also a lot of responses that highlighted that software systems and data infrastructure was a hurdle. So 44% said software systems do not capture the impact required, capture the information required. 19% said other software issues, including interoperability and connectivity, was an issue. And 16% said they experienced data security and storage issues. So how can we overcome some of these challenges? One of the ways we can overcome or mitigate some of these challenges with outcome measurement is to outsource our research and evaluation work. For example, to mitigate some of the issues around time and expertise, we can hire consultants or partner with universities. This leads us to our guest speaker component of our discussion today, which will explore this concept of community services and universities working in partnership to achieve outcomes and demonstrate impact. So the complex nature of emergency relief services means it can be difficult to capture data and report on outcomes. This challenge led St Vincent de Paul, Queensland to establish a successful data partnership with the University of Queensland School of Social Science. It has enabled St Vincent de Paul to collect and analyse data during emergency relief activities, understand service delivery from an evidence base, and support University of Queensland's ongoing research. So it's my pleasure to introduce our guest speakers for today. Nathan Middlebrook is the State Manager for Community Engagement with St Vincent de Paul Society, Queensland. His responsibilities include management of youth, refugee, financial and education services across the state. In 2021, Nathan was awarded an adjunct fellowship through the University of Queensland for his contributions to the UQ St Vincent de Paul Research Partnership. And Dr. Christina Blazer, or Tin, is a postdoctoral research fellow with the School of Social Science at the University of Queensland. Her research leverages advanced quantitative methods to examine different aspects of economic and social disadvantage, including informal and other forms of non-standard employment, housing and homelessness, and gender and sexuality. Her research has been published in international journals such as the International Labour Review, the American Journal of Public Health, and Sexuality Research and Social Policy. So it's my pleasure to hand over to Nathan and Tim today, and I will stop sharing my screen.
We'll start sharing, yes. Thanks, Amy. Appreciate, just make sure I'm off mute. That's right. Thank you for that generous welcome and the invitation to talk today about our wonderful partnership with University of Queensland. We've got plenty to go through, so I'll just bring up our screen and share. There we go. I was saying earlier, I have a very dry, monotone voice, so hopefully Tim can liven things up with her contributions. But we're also, I think our presentation style will be fairly informal and conversational. So if you do have any questions or comments you'd like to make throughout, please feel free to shoot them through and we can have a chat as we go. Otherwise, there'll be some time at the end for a Q&A session. But let's jump into it because we've got plenty to talk about. So yeah, today's presentation, we'll just have a quick snapshot of where it all started and how we got to where we are. We might dig into some of the mechanics of it as well, which could be informative for organisations looking to do something similar. We'll have a look at the highlights, and there's plenty of them. Benefits and impact of the partnership. So obviously today is about data impact, and so that'll be talked about throughout the presentation. And the benefits as well from all partners. It's the genuine nature of the partnership is producing mutual benefits. So we really want to highlight what those are. Of course, there's always challenges and things that we're learning along the way. So we'll talk about those challenges, which you've probably already touched on a little bit as well, Amy. But what our solutions have been to try and address some of that, and we're still, trying to address some of those things as well. Lessons learned and a bit of an overview of what's to come in our future. So, history of the partnership. So we won't go back to when the society started in 1864 or something like that, but we might just go back to 2006 when we first adopted an emergency relief database. So for those of you not aware of St Vincent de Paul Society, we deliver a whole range of programs across homelessness, child and family, disability, refugees, etc. But some of our core work is driven through our volunteer membership, and it's around that emergency relief response to people in immediate financial crisis, financial assistance, material aid, information and advice and referral. So back in 2006, 2007, we adopted a database for that activity. And then fast forward probably 10 years, we found that the database was being very thoroughly used at the local level, at the ground level, in terms of case history and using that case history to assess and determine levels of support and type of support. However, it wasn't being overly used at an organisational level, and certainly not at a sector level or at a systems population level to determine impact. So one of the ideas with our social justice committee was to recruit a policy and research officer. But one of the members on that committee was also a lecturer at University of Queensland, and so set up a conversation with UQ about what a potential research partnership would look like. And it looked like it would meet the objectives of what that social justice committee wanted to achieve around advocacy, but it also had the potential to really inform some of our service model improvements and continuous improvement processes, and a whole range of other things which we'll get into later on. So we set up a one-year partnership, 12-month partnership in 2017, and it produced plenty of things which again we'll talk about a bit later on. And it went so well that the board decided to extend that partnership for another 3 years. And then again in 2020, we extended it another 3 years. So it's obviously doing something right, and let's find out what that is. This slide is just to talk, briefly give you an idea of the stakeholders involved. So the top three are internal stakeholders for us, for St Vincent de Paul. Everything we do has the clients at the forefront. So obviously they're the beneficiaries of any advocacy or service improvement that we make through this research. Our members and volunteers, we have approximately 3,000 members across the state delivering emergency relief, and an extra 4,000 or 5,000 volunteers through other programs and services like retail. And then our exec team and board and advisory committees are also heavily involved in this research partnership. Externally, we've got our friends at university, and Tin could probably talk to who they are within her circles. Did you want to touch on that quickly? Or?
No, I think that's good. Yeah. I mean, from the university perspective, I think that it's important to understand that we also have deliverables from the university perspective, and that influences the kind of output that we do produce, which we'll discuss later on.
Government, and that probably could be termed funders. So our ER's funded federally and state, but we also have donors and other fundraising channels that we report to and provide evidence of the impact that that funding is having. So research obviously feeds into that. And then other stakeholders, our friends at QCOS, and this presentation is an example of that. But there's many other networks and interagency sessions that we've sat in to talk about some of these issues. So we'll go to the next stage. This is basically a snapshot of how it works. So we'll start with the agenda setting. We have a steering group of executive staff and board members that come together with the UQ team to set what the research agenda looks like. And it's informed through our strategic direction, our strategic plan, social justice agenda priorities, but also previous research and findings that we've found through previous iterations of the research. So once we have that broad sort of overview of where we want to go and what we want to target, we then move into more of a brainstorming, a lower level sort of piece of work process, where we refine what those research questions are and really define them to set the scope of what we're looking for. And that's done with the respective program areas or expertise in those respective areas. And a lot of that also happens between Tin and myself. Tin actually sits on site at St Vincent de Paul's State Administration Office 1 day a week on a Thursday, and is able to engage with the relevant parties and also just to be immersed in the building and hear the conversations and have a stronger understanding of what the data means and what we're trying to achieve. We then move into a research phase, which is predominantly done through the UQ team, where they clean, analyse and interpret the data. But there is again that constant communication and dialogue between the relevant areas to understand what the data is and what they're looking at. And then finally, there's a communication piece, which is pretty key to once we have the findings and the research outcomes, to get it out to all of those stakeholders on the previous slide, which we do through a number of channels. And I think that probably the thing with this whole, I really like this slide, because if one of those things isn't working, then it throws the rest out of sync. So if we don't have a clear, broad agenda, everything that we do doesn't it's a little bit meaningless. Similarly, if the communication's not there, we might have the solution to the meaning of life, but if we can't communicate that to the people that it affects, then it's pointless and it just gathers dust. So is there anything out of that slide that you wanted to?
I think Nathan really gave a really good description of how the partnership operates. I won't get into that. I guess the only things I would add would be first, it's important to note that the research we do through this partnership is actually an additional thing on top of the day-to-day operations and analytics that Nathan and the rest of the Vinny's team probably do. So this research partnership actually focuses on overall, how can Vinny's improve their service delivery? What are the things that they can advocate on? And that's where we kind of step in. The second thing to note is really, this is a very co-designed research process. So as you can see here, from agenda setting up to the actual communications, the partnership really operates in each step of that process. So it's not like we come in, what research questions do you want to answer through the partnership, and then we just submit a report. So a lot of partnerships may work that way, but in our case specifically, we make sure that each step of the process, both parties are involved. And one thing I did want to highlight from the previous slide on the policy and research officer. So some of you may be wondering, like, what are the benefits of actually getting into a partnership with a university versus probably just hiring a policy and research officer? I mean, some organizations do that, but I think what we've been able to bring through this partnership are really several things. So for example, being situated in the university context, we have access to research and evaluation resources that may not be possible or may not be easy to obtain if you are working as a policy and research officer in an organization. So for example, we have ready access to academic journals or other academic resources, which could have paywalls. And we all know that could be pretty expensive to get access to these articles. Of course, access to experts as well. So for example, being situated at the School of Social Science, I can draw on the expertise of different people who could be specializing in different things, which I may not be a specialist on. And of course, we could also leverage our existing partnership to actually attract more funding, for example, from the Australian Research Council. So I think having access to those different resources really makes a difference, and that kind of makes the partnership more attractive versus potentially just having someone sitting within an organization as a research and policy officer.
Perfect, well summarized. And just to add, we're talking about emergency relief as well, and Amy, you mentioned, or you referenced it earlier, that it is quite a difficult area to capture some meaningful outcome reporting and impact reporting. So while we have access to dashboards and reporting at an ER output level, we were lacking that understanding of what actual difference we were making in people's lives, in emergency relief in particular. So that's where we needed some expertise to come in and help sift through the data to work out, which we'll see, what is making a difference, what do we need to look at to identify what are the measures, I guess, and also improve our data capture and our data quality as well, so we can set ourselves up in the future to capture that better. So let's have a look.
So one thing I also did want to mention on that previous slide was the emphasis on the cycle. So for example, in the past year alone, we've delivered 4 policy notes through the research partnership. So each of those notes actually followed the same broad process. So we always start with agenda setting, and then we do the brainstorming, we do research and communication. So for example, for all those 4 notes, we basically followed the cycle. So that's how it usually goes. Now, you may be wondering what kind of data we're working with. So Nathan has already mentioned that this is really primarily focusing on their emergency relief program. So they have a database called CARE, which contains records of all the emergency relief assistance. So because the partnership has been going on for some time, the first segment or the first part of the partnership actually leveraged around 10 years worth of data. And this was before the migration to the new system. So in the current research partnership, we're already utilizing data from the new database, which is through, I think, Microsoft Dynamics. Is that right? And then after that data is extracted from the Microsoft Dynamics system, we actually use a different program to clean, organize, and analyze data. So for example, I myself use Stata, which is a statistical software. So we export that raw data, de-identified data into Stata, and then do the analysis from there. So in the latest version of that data set had about 300,000 records spanning from 2018 to 2021. And those 300,000 records correspond to about 75,000 clients. There is a wide range of variables in that data set, around 180. A lot of those 180 variables are from the raw data that has been extracted from the CARE database, but we also create additional variables or merge variables from other data sources. For example, remoteness, information, or index of relative socioeconomic advantage or disadvantage. Some of the kinds of variables that we create in addition to what they have is, for example, what is the length of time between visits for a specific client, for example, and things like that. So that's essentially what we use to perform our research and to produce the policy notes. Did you want to add anything else there?
Yeah, I guess the difference between the first iteration of the partnership and now, that 10 plus years of data was basically, we were sitting on a big data. We didn't know what to do with it or how to. It was mainly just an exploratory sort of exercise to see what was there and what we could potentially tease out and drill down a little bit more. Whereas we've gone with a shorter time frame here because we were really interested in the impact that COVID had with service delivery, and we had as part of our research agenda or research priorities, that was an area of target. So that is also why that we're using a smaller, a relatively smaller sample size. So yeah. So highlights, so many. We have, well, we can see here, we've delivered 4 research reports, 4 evidence notes, 2 journal articles with another 2 under review. And just to, without to go too much into the content, but probably more the format, which is quite interesting, is those initial research reports were very dense documents. They were very comprehensive. They had all of the methodology and the statistical language in there, which was fantastic. But through our evolution of the partnership and identifying some of the challenges around communication and having something digestible for our membership and for other stakeholders, we've kind of morphed into a bit more of this evidence note style, which is a bit snappier. It's 3-4 pages, has highlights and some graphs and tables in there. And it also usually tails off with a recommendations section around at the end as well, around continuous improvement, training, data quality, data capture, advocacy, that sort of stuff. Yeah.
I think just having that evidence note format, which is much shorter and much more condensed, allows us to cater to more of the stakeholders, which we touched on earlier. So we do have the university, but we also have the members who are actually carrying out the emergency relief program on the ground. So of course, it's important that we reach out to them. Whereas, for example, with the previous reports that may have been read by, let's say, the executive committee or other committees, we wanted to make sure that this would cater to a broader audience. And I think another key advantage of having brief policy notes is it allowed us to be more flexible and more agile in terms of the topics that we could tackle. So for example, a dense research report could be focused on one topic, like really a deep dive into a specific topic. But by having 4 evidence notes, we were actually able to touch on quite a range of topics. So for example, we had an evidence note touching on domestic violence and how emergency relief actually helps clients experiencing domestic and family violence. Another one, which you see here on the screen, touched on income support. And we analyzed how, let's say, the COVID supplement during 2020 to 2021 actually interacted with demand for emergency relief. And of course, the journal articles, this kind of speaks to the fact that the university is also a stakeholder in this partnership. And because the university values the production of knowledge primarily through journal articles, it's also a deliverable for us, primarily for me, to make sure that out of that research partnership, we are also able to deliver on the need to produce that academic research, which happens through journal articles.
Amy, I don't know, I'm too scared to press the chat button in case I lose my screen. Is there anything that, we just pause here, is there any comments or things coming through that we needed to touch on?
I wasn't sure if you wanted to keep the Q&A till afterwards, but we have got one question come through from Paul Butler, who's at IFYS. So he's asking, can you please provide the name of the data cleansing software used, mentioned by Tin, after the data comes out of MS Dynamics? So kind of between from MS Dynamics, is there a middle ground and then into Stata? Okay.
Yeah, so basically, well, the first extract we had, the data actually came in a CSV format. So I think the Microsoft Dynamics program allows you to export data in that CSV or Excel format. And then from the CSV or Excel format, you can then import that into Stata. And really much of the cleaning happens in Stata. Cleaning and analysis.
Great, thank you. That's all the questions for now. We might share the links to all of your journal articles now in the chat as well, if that's okay. That would be great.
Cool. And I think in addition to the actual research output that we have produced through the partnership, it's also important to note that we do also engage in, let's say, internal and external presentations. So during the past year or so that I've been involved in this project, we've had numerous internal presentations to the different stakeholders within the society. So that includes the different committees, actually going to conferences or local parish groups that administer emergency relief. We also do external presentations, and today is a prime example of that. We've also delivered presentations to DSS, for example. Another key highlight from the partnership is really the data improvements that have come out from this partnership. So I think Nathan kind of hinted on this earlier, but the first segment of the partnership, the first couple of years, was really about finding what the data issues were and then making suggestions to the society on how they could improve the collection of their data to make it more suitable for research and for analysis. And that, again, is an ongoing process, because even if the society has transitioned into this new system, which is much, much improved compared to the first one, there are constant areas of improvement. And by researching and analyzing their data, we can kind of feed that back to them and say, oh, you know, you need to improve this specific variable, or you need to improve how you collect the specific data. I think one prime example of that would be the DV evidence note, where we actually had a series of recommendations on how the society could better capture not just domestic and family violence status, but also things that feed into that. For example, whether they capture referrals to other organizations and the kind of assistance that they provide to people experiencing that. Another example could be improving the quality of income data. So for example, they could get, upon intake, they could get information on what are the income sources of the client, but it's possible that that data is not updated, which means that for subsequent requests for emergency relief, we don't actually know how those income sources have changed for that specific client. So those are just some examples of data issues which we've worked on with the society, and that's something that's currently and constantly being worked on.
Yeah, and that's a good example. That DV one's a good example where our database didn't actually have an indicator for domestic violence.
Yeah.
So, from a desktop research or a dashboard sort of perspective, we didn't have any visibility there. We had plenty of anecdotal evidence through our membership, but we didn't actually have any data around it. So UQ were able to, I don't know the language, text mine, using text fields where domestic violence or similar terms were identified in the interaction, in the assistance record, and then able to analyse that and show that yes, we are a point of contact for people in need in crisis with domestic violence, and that's then helped inform how we identify those similar cases, how we capture and refer, and our response to some of those cases as well, how we resource. So yeah, I recommend reading that evidence note because it's one of the good ones.
Yeah, and it's actually one of those 2 articles that are currently under review. So we've gone through 1 round of peer review under the British Journal of Social Work academic journal. So hopefully that'll get published, and we will provide open access to that article once it comes out.
Benefits and impacts. So I'll go first. I think we've talked about some of these, but we improved data collection and quality. I think that's something we've just. I should also mention one of the reports that came through was incredibly timely because it was when we were moving from the old system to the new system, and one of the reports was specifically on what improvements could be made with that transition. So that really informed our IT and development teams and program teams as well. So that's been great. Refined service models and practices. So another one of the reports, one of the initial reports was looking at repeat requests for assistance and using that as I guess trying to find the drivers, identify the drivers for why someone would come back for assistance regularly and why someone wouldn't come back for assistance regularly. And one of the key findings, or the key driver for someone not coming back for assistance, was the amount of time spent that we were spending with them. So out of those 180 variables, that was the one that was clearly one of the reasons why someone wasn't coming back. So that then opened up a whole bunch of new questions about what are we doing in that time that we're spending with people that's making a difference. But it also then helped us refine our service model, because at the time there was this internal philosophical debate about there was more cases coming, we were receiving more requests for assistance, we were seeing more complex cases coming through as well, and we had some people saying we need to get everybody and volume, quantity, let's go. So we're going to bump up, instead of 5 people this afternoon, we're going to see 10 people. We had another group saying, let's slow down, let's try to unpack what the underlying issues are, and we won't be able to assist everyone that knocks on the door, but we'll be able to better assist those that are coming in the door, and then hopefully stop them from coming back, so that they're more self-sufficient and able to change their life circumstances in whatever ways that is the underlying cause. So we had these 2 opposing thoughts, I guess, and with the research and with the findings, we were able to present them to our board, we were able to present them to the membership, and we were able to reflect and refine that service model, and look at the ways in which we could increase the time that we're spending with someone, but also then feeding into a future research question of, what are we doing during that time? So that's an example of that service model. We've also looked at home visitation versus centre-based support, COVID income support and different things. So that's been a great benefit. Increase in government ER funding, that's a fairly obvious one, where during a grant application or tender response, we're able to draw on actual evidence to demonstrate that we are making a difference, and how our service model delivers against the investment specifications. It's also, outside of government ER, it's also really useful for case studies and other donor communications as well, to strengthen that story that that we're making a difference. And advocacy is probably the other really big one that we've been able to use this for. Some of the research, which I've touched on, obviously has a real continuous improvement focus. Other things have much more of an advocacy focus. So the income support thing is obviously something that we're keen to communicate with government about, the level of welfare assistance or income support that someone receives, and how that makes a difference to the organisations like ours that see people that are on those support levels, support payments. I'll let you talk to this one.
Right. So from the unique perspective, we also benefit tremendously from this partnership. So if you work in a university, just the chance or the opportunity to work on a unique administrative data set that is not readily available to the public is already in itself a huge benefit, and that kind of feeds into the second benefit, which is producing impactful research. So one thing that researchers could get out of having access to a unique administrative data set is to increase chances of getting work published, because usually journals and peer reviewers would be interested in finding out what insights could be generated from such a unique data set. And also, apart from that, the work being published, just the fact that this research actually has real impact or real relevance to practice makes it hugely impactful. Also, just the fact that we have this partnership, and a huge part of that partnership is actually funding for research. And as you know, with academics or people working in university, there are competing responsibilities. So research is only one of the things we do. We do teaching, we do administrative work, we do other things. But having this partnership and the funding that goes with this partnership actually allows us to dedicate 100% of our time. For example, me to actually work on just research and presentations that are related to this specific partnership. And finally, it's also important for universities increasingly these days to not just be, that ivory tower that operates in isolation, but it's actually becoming increasingly important for us to establish connections on the ground, because then again, that's how we create impact. So we can produce purely academic research, but it becomes less meaningful if that doesn't actually translate to practices or changes on the ground. So I think those are the main benefits for us. Yeah. Right. So I think it's a perfect time to start talking about challenges. Yep. Okay. Did you want to start with this?
Yeah, sure. So we've got, there's differing challenges. We've pulled out 5 of the key ones. So we'll go through one by one. Multiple stakeholders and personnel changes can complicate project buy-in and continuity. So I think, we've been going for probably 6 or 7 years now. 6 or 7 years, yeah. And over that time, we've had different CEOs and different board changes, different personnel changes, and I guess that talks to the partnerships embedded into each of the organisations, so that it can continue without falling over. So, oh, there we go. Yeah, sorry, I'm just reading the slide now. That's exactly what it says. So that's and like I was saying earlier, TIN being visible on site is just it's a UQ presence within the organisation. That's an example of how we've tried to increase that integrated sort of approach with the partnership. Time-consuming processes, so legal processes, ethic applications, data extraction. Partnerships in general take time, as we all know, and this one's no different. I think a lot of these challenges came at the very front end of the partnership, in setting it up structurally and with that contract negotiation or agreement development. Since then, we've been able to kind of piggyback off those agreements and mainly just change the schedule of deliverables and kind of focus area, but maintain everything else, which has been quite useful and time saving. Data extraction as well was one that we sometimes get unstuck with. The previous database was very difficult to extract data. This one's a lot easier, and we're a lot less reliant on the developers to take that out. We can do that ourselves. So that makes a difference. Data issues, administrative data may not be suited for research. Yeah, so that's been a piece that we've, it's a challenge, but it's also a real opportunity for us to get it right and to refine our data capture and measurement measures. But the way around that, which I'll let you obviously talk to.
Yeah. Okay, so I guess a little bit more on the kinds of data issues that we've encountered. So one thing that's been pretty common is having missing data. So you could have this huge data set, 180 variables, 300,000 observations. It sounds great. But in practice, once you dig into each of those variables, you see that, out of those 300,000 observations, maybe only a half of them would actually have information on, let's say, income sources, or, even things like country of birth could be missing as well. So even those basic demographic variables could be challenging to analyze because not everyone provides responses to those questions, or not those data are probably not regularly collected. And it becomes an issue for research because that missingness in the data could be systemic. It's possible that it's not random. So once we do analysis and the analysis hinges on missing data, it's possible that the results could be biased because we are only analyzing a subset of the large database, and we don't actually know the characteristics of people who are in providing those responses. Another thing that we currently encounter is possibly inconsistent data entry. So again, hinging on the income example that I talked about earlier, it's possible that that information is collected upon intake and then possibly not again in subsequent requests for that individual. Or it's also possible that it's collected at random times during a client's journey with the societies. For example, they could get updated upon intake and then again on the third or fourth visit and then not again on the next visit. So it kind of makes the analysis challenging because you have these missing bits that there's no way for you to know what happened to that client in that specific time period. So given all those different data issues that we've encountered, we've had to leverage different ways of addressing those issues. And one of the things we've done is to actually deploy mixed methods. So I'm a quantitative researcher, but my predecessors or other team members are qualitative researchers. So what we've done is to combine both quantitative and qualitative research methods. So for example, the study on the service models comparing home visits versus service centers, that actually entailed ethnographic research where UQ researchers would be on the ground interviewing participants, asking them what the constraints are, what their preferences are. And in terms of just doing the quant analysis, what we've tended to do is to focus on high quality variables. So within that 180 variables in the data set, the quality of each of those variables could vary very much. So for example, age and gender, indigenous status are usually high quality variables based on our experience. But as you go more details, for example, income sources or even residential addresses or other things, employment status or number of children, then the quality of the data becomes more varied. So you don't know how reliable it is. So we've done our best to just focus on the variables that we know are reliable relative to the others. And finally, we've also leveraged other data sources. And I kind of hinted on this earlier when we talked about merging other variables from high quality data sets. So for example, one report that was produced in the earlier years was actually looking at the role of spatial variables. For example, how economically advantaged or disadvantaged an area is and how that kind of influences the demand for emergency relief. So that variable actually came from the Australian Bureau of Statistics. But having those postcodes allowed us to map the economic disadvantage or advantage in that area, and then to analyze it accordingly. So those are just some of the workarounds we've adopted. Again, it's an ongoing process, and we're constantly trying to find ways to overcome data issues, which is, I'm thinking, pretty common in this sector. Did you want to talk about change management?
Sure. So changes to service models. Basically, yeah, like I said earlier, we get these wonderful reports and findings, but the challenge is then implementing the recommendations or considering the recommendations and potentially implementing them. So again, these things take time and communication, which is the final challenge there. But that's just something that we've had to build into our planning and into our communication strategy around what we do and how we get that buy-in. And then, yeah, finally, communication. So this is large, or not largely, but partly due to St Vincent de Paul's limited internal communication systems, I think. We have challenges outside of this in communicating with volunteers and members across the state. So to ensure that everyone is informed and kind of on board with some of the findings that we've found, it's using various channels. It's using our intranet, it's using emails, but it's also doing presentations like this, face-to-face workshops, which Tin has attended with some of her colleagues, actually going out to regions to talk and discuss, facilitating sessions, presentations with our board and advisory committees as well. So it forms a big part of the piece, is ensuring that we are communicating and disseminating the results to those that need it. That's internal, and obviously external as well, that we need to make sure that we're not just sitting on this and we're acting on this, and ensuring that the rest of the sector and community is aware as well. So that's our challenges and solutions. I think this is a bit of a snapshot, overview of what we've just talked about, but probably the first point I won't let you. Are you able to talk about it?
Yeah. Okay. So we've been working together, Nathan and I, for over a year now, and we have learned so much. We could keep talking way after the time limit, but I guess this is like the top of our list in terms of what we've learned so far from working together, working on this research. So for me, from my perspective as a researcher, I feel like organizations need to reach a certain level of maturity to have productive partnerships with universities. Now, this sentence for me contains two keywords. So for the first one, it's really the level of maturity that I think is key to the second keyword, which is productive partnerships. So when I say level of maturity, I'm really pertaining to the data systems that an organization may or may not have. So obviously, we can only do so much as researchers, and that kind of talks to the second point here. But it's really essential for organizations to have, at the very least, a system in place by which they can collect their data in a systematic manner, and also can extract that data on a regular basis, so that researchers would have something to work with. So I think that's the first key thing. And again, the second key lesson: good research requires good data. I mean, we can adopt different statistical methods, we can clean it as much as we can, but in the end, our research is only really possible because there is good data to back it up. Yeah.
Time we've talked about, but to our board's credit, they recognised that a longer term commitment was going to result in better outcomes through this partnership. And while we could have settled for a 3 or 6 month sort of project and got something out of it, I think it was limiting to all parties really. So what we've been able to achieve over a multi-year agreement, also in terms of funding, like Tin was saying about UQ being able to leverage their own linkage grants and things like that, that's been to the benefit of the partnership. So that's important. Open communication and embeddedness with the organisation are keys to success. That's I think been that. I can't understate that enough. That we've all been involved in partnerships ranging from very transactional or philanthropic sort of arrangements through to something like this, which is genuinely real. It's got shared goals, shared decision making, clear communication between the parties, and commitment. Both parties are really committed to making this work. So, excuse me. So I think that's a real key to the success of what we've achieved. And then effective dissemination of research findings is critical to achieve impact. So that's what we're here to talk about, is data impact. And like I said, there's no point us sitting on any of this and not using it. We need to communicate it out. We need to build into our advocacy, into our service models, and actually use it to achieve greater impact and understand our impact as well.
Right. So I guess we're in the final slide now. Opportunities for future research. So this is broad, and it doesn't only apply to Vinnie's, but also to potentially to other organizations as well. But for example, the first opportunity that we see is actually measuring program impact on clients. And Nathan has talked about this earlier. He mentioned that one of the reports from the partnership was actually focused on repeat requests and what influenced the propensity to make a repeat request for emergency relief. So that kind of hints at the limitations of data sets in the not-for-profit charitable sector, where we don't really have measures on what the outcomes are for the clients once they exit a program. And I think that's a pretty common experience. Nathan has already talked about with me before, potentially having more variables in that current system that could, let's say, measure satisfaction with their service and whatnot, right? Maybe you can touch on that later, Nathan. And then another thing that we're thinking of is to be able to link internal data sets, let's say within the society alone. So emergency relief, we've been analyzing this data set for years, but as Nathan mentioned earlier, Vinnie's has so many other programs. They have education programs, they have housing programs, etc. But so far, we've been unable to actually link these different data sets together because of different reasons, including, for example, having different data systems for each program. So the emergency relief database could be sitting within the Microsoft Dynamics environment, but let's say the housing data could be sitting in perhaps an older system, and it's hard for us to merge those data sets together. So that's definitely an opportunity area for the society in the future, because then it allows us to map a client's journey within the society and understand what touch points the client has within the society. The third opportunity area for us is to actually be able to partner with other community organizations who could be collecting similar data. So a prime example of that would be our most recent evidence note on income support. So in that evidence note, we actually partnered not just with Vinnie's, but also with Salvos. So we leveraged two data sources, the Society's data source on emergency relief, but also the Salvation Army's data set on emergency relief. We merged that together, and then we mapped the payments during the prime COVID years, 2020, 2021, and we used that merged data set to understand how the income support payments during COVID actually influenced emergency relief. And just by having those two data sets, we were able to capture about 70% of emergency relief clients in Queensland. Finally, we want to also understand long-term client outcomes, and we believe that would only be really possible if we are able to link our data sets or the society's data sets with government data, because then you can see how else how they've managed. So for example, it's possible that they stopped going to the society, but then they may have gone to another emergency relief provider. And right now it's not possible for us to actually know whether that's happened. Another thing that we could do with government data is to link, let's say, with health data sets or with employment data sets, etc. And that would provide a more well-rounded impact measurement or impact evaluation. Do you want to add anything?
No, I think, yeah, that's the exciting stuff for us, is that data linkage. We're really keen to look at internal and external data linkage opportunities. Yeah, I think, how does no interest loans impact our emergency relief provision, or vice versa, or homelessness services, and etc. So that's exciting. There was another thing you were saying. No, it doesn't matter. Doesn't matter. Okay. Yeah. Anyway, that's what's on the horizon for us. That's it. Yeah.
Time to kind of open it up for any questions. If anyone wanted to raise a hand or pop any more questions coming through in the chat. Otherwise, I did have one question which you guys really covered so well already, but I think, and you touched on, the data systems maturity being required, but I was wondering, for this kind of research and evaluation work, would you say that a data partnership with a university is achievable and feasible for smaller or medium-sized not-for-profit organisations? Like, is there a specific budget that's allocated towards the research and evaluation work? And what advice would you give to other community service organisations that were kind of maybe considering going down this path, like to explore or set up a data partnership? Kind of, where would you say they start? There was a lot of questions in one, sorry.
Yeah. Did you want to take the first part, which was the small, medium, like that talks about maturity thing and systems, I think. I can talk to the budget.
Yeah, okay. So I guess there's obviously a high correlation between the size of the organization, whether it's small, medium, or large, and the maturity of the data system. So you would think usually that, large organizations like the society would have the capacity to have data systems in place, funding in place, etc. But I also don't think that those things are, mutually exclusive. I don't think being a small or a medium organization will hinder you from having a productive partnership with a university. I would really focus more on whether you have a system in place with which to capture the data, regardless of whether you're a small, medium, or large organization. I mean, it's possible that you could be a medium organization, but you already have a well-developed data infrastructure that allows you to get a good record of the assistance you provide or the service you provide. And I think ultimately that's what matters rather than the size. But I guess where it would matter more would be the funding, because obviously research does take a lot of resources, and I will let Nathan speak about that.
Just while it's in my head, it might also be worth pointing out, this isn't on our script at all, but the hub, the park project, just as an example of where that's a new program or a new service that the UQ are helping with the evaluation framework and set up, I guess, the program. Did you want to?
Yeah.
I mean, that's another example of how you can engage with a university at the early stages of a new program. In terms of budget, we had, with that research officer role that we were originally thinking, we had a very limited budget there that we were playing with, and that was the reason why we didn't go down that track, because we weren't going to get someone for the amount of, the budget that we had that would be able to fulfill the objectives of that social justice agenda. So I think also having UQ be able to stretch that money and get better bang for our buck by adding their own kind of funding opportunities has also grown that dollar to $2 to $3. Lots of in-kind things going on as well, where we talked about it earlier. Sometimes we'll get an ad hoc request come through for something where UQ are generous enough to slightly step outside the scope of the original agreement deliverables and able to assist with some of those requests, which have been highly valuable. But in saying that, going back to that multi-year commitment is probably, the longer you can budget for something like this, I think is more beneficial, because those short-term commitments, while you will get some result out of it, it's probably not going to be a game changer like a 12+ month sort of commitment.
I think, yeah, that's a really good point, Nathan. And I think that kind of gave me another idea. So on the question of what would you advise other organizations who are looking to maybe undertake a partnership with the university, I think organizations need to be clear and need to ask themselves what they want to get out of the partnership. So everything that we've talked about so far in terms of what is necessary, etc., that has been primarily based on the assumption that the organization already has data that's been collected and they want us to evaluate that. But what has become clear through this partnership is that there are other avenues through which universities could work together with community organizations, and you kind of touched on that when you mentioned the hotel, which is really on just setting up basically their data. So for example, organizations may not have even an existing data collection system, or they may have one, but that data has never been analyzed. So the first part of that partnership could potentially be just exploring the quality of the data. Are there opportunities by which organizations could improve data collection practices? And then if it is good enough, then research could then come out of that.
That answer your 6 questions, Amy?
Yes. Thanks so much. We've just got one more comment coming through from Anna. Thanks, interesting and great research. Sorry if this was spoken about, may have missed it, but just curious what the outcome was about the extra time spent with clients versus quantity of client flow was.
Yeah, it was one of our very early reports that we received, and it did have a specific number. The extra 10 minutes you spend with someone results in a whatever % decrease in people coming back. So there was and those reports are available, you said, on the links here. So definitely recommend you read it. But yeah, that was essentially it. That was, I think, the other driver for people most likely to repeat requests for assistance was housing addresses, change of address. So if someone had changed their address more than twice over the previous 3 months, they were, again, 40% or whatever more likely to seek assistance compared to someone else. So yeah, I mean, I recommend you to read those reports that we should have links in the chat section for.
Yeah, I think that specific piece of research was one of the 2 journal articles that we mentioned earlier. So it's been published in the Not-for-Profit and Voluntary Sector Quarterly Journal. And I think Amy should be able to share the link to that article if you're keen to read more about that.
Yes, that's wonderful. I'm just conscious of time now, so we've just hit on the 11:30 mark already. So absolutely, we'll send out all of the resources that you've been more than happy to share with us, which is amazing. I think in summary, you're definitely contributing to our data impact vision for the sector, which is exciting and amazing, and it's really evidence that your evidence is informing and redefining your service delivery. The aspects of the research findings informing CQI and your advocacy work. It's all just really wonderful. So thanks so much for sharing today. We really appreciate your time and enthusiasm to share and connect with the network, and we look forward to collaborating with you further. If anyone has any more questions, please feel free to take this offline, and we can make those connections with Tin and Nathan after the webinar as well. So we just had some final polls to finish on today. So again, thanks everyone for staying online with us and engaging. So there's 5 questions here. How would you rate your understanding to measure and report on outcomes? How would you rate your confidence to measure and report on outcomes? How would you rate your capability to measure and report on outcomes? And then from 1 to 5, how satisfied were you with this webinar? And did the content of the webinar increase your knowledge on how partnerships with universities can support community organisations to measure and report on outcomes? And I will sign off there. Thank you, everyone.